When treating small animals, your canvas is rarely still. The physical challenge of veterinary bandaging is that you are securing materials to dynamic anatomy, floppy ears, expanding torsos, and constantly wagging tails. In this guide, we will break down the exact steps required to securely place and maintain bandages on these three difficult anatomical locations. The techniques we will cover are drawn directly from this text: small animal bandaging, casting, and splinting techniques. Before we begin, you will need to assemble a specific toolkit. Gather your 2-0 monofilament suture, precision scalpels and blunt-tipped scissors, highly absorbent laparotomy pads, and lengths of orthopedic stockinette. Here is the danger of selecting the wrong base layer. If you use a wide mesh semi-occlusive dressing as your primary bandage, fresh granulation tissue and epithelium can grow directly through those perforations. When the bandage is eventually pulled upwards, it rips that new tissue away. Selecting and securing the correct primary dressing dictates whether your bandage accelerates the healing process or actively damages the wound during a routine change. Step 1. The head. The clinical objective is to immobilize an injured ear against the skull while still maintaining an open channel for daily topical treatments into the ear canal. A highly effective field technique is to cut a section from a pair of pantyhose or use a length of orthopedic stockinette. Pulling this tightly over the dog's head pins the ear flush and keeps it stable. Once the wrap is secure, take a medical marker. Feel for the opening of the ear canal beneath the fabric and draw a precise target square directly over it. Watch the scalpel here. We use the sharp blade only to score the outer tape layer of that drawn square. We do not press deep enough to cut the underlying wraps. Switch to your blunt-tipped bandage scissors. Slide them underneath to cut through the isolated tape square and the secondary wrap below it, lifting the entire block away. By isolating the scalpel to the exterior tape layer, you prevent lacerating the patient while successfully creating a perfect, reusable window for administering medication. Next, we address broad thoracic or abdominal wounds. Wrapping a bandage completely around the torso to secure a wound can easily restrict the patient's breathing, requiring a completely different anchoring approach. This top-down diagram illustrates the tie-over system. You place loose loops of 2-0 monofilament suture in a perimeter around the wound, anchoring them strictly into the intact, healthy skin. Build your stack. Place your moisture-retentive primary bandage directly over the wound bed, and top it with a thick, highly absorbent layer like a laparotomy pad. Notice that the outer suture loops remain visible. Now take your tying material and begin lacing. By threading it back and forth through those pre-placed suture loops, you tie the entire absorbent stack tightly down to the body. Decoupling the bandage from the rest of the torso creates a highly localized, secure seal that remains flush against the wound, even as the animal's ribs flex and expand. Finally, the tail tip. The outward centrifugal force of a wagging tail dictates that standard gravity wraps and light adhesives will instantly fail and fly off. The preparation must be strict. Aggressively clip the hair proximal to the wound and perform a complete aseptic scrub to expose the bare skin. Apply the necessary medication to the tail stump and carefully place a piece of gauze directly over the tip as your primary dressing. This side-by-side comparison shows the anchoring mechanism. Wrap 1-inch medical tape circumferentially over the gauze and ensure you extend it tightly onto that bare, freshly prepped skin shown on the left. Binding the tape tightly to a hairless friction zone creates the mechanical grip necessary to counteract the extreme kinetic force of the tail. We have now successfully deployed 3 specialized fastening techniques across our most dynamic patient locations. The ear wrap guarantees unblocked access. Tie-over loops offer slip-resistant torso coverage. Friction anchors provide force-resistant tail binding. As you track the healing process, remember to continuously monitor exudate levels. You must step down or change the primary dressing material to match the exact stage of the wound's recovery. Keep pre-cut sections of pantyhose and orthopedic stockinette permanently stocked in your clinic's field kits, ensuring you can deploy them immediately during an active emergency. By utilizing these 3 specific anatomical anchors, you eliminate the variable of patient movement, ensuring a controlled environment for tissue recovery.